Yeah.
So he's like,
Hey,
we
what's
are
his
not
name? Lohit Reddy?
Lohit Reddy, yeah.
Okay, perfect. So, yeah, continue. What were you saying?
So he's like, we are not going to call you to the hospital, as right next to the main gate is the PG hostel.
Hmm.
You only have to come there. We will not call you to the hospital area also.
Hmm.
And I asked him what precautions. He said, as long as you're wearing a mask, it should be okay. You don't have to hand it over to us. You can, we'll be standing there. I mean, if you feel that way, you can just leave it on the table where we are. But it will be nice if you can come and give. There are no issues as such. And he said, we will not take you to the hospital main area, he said.
Okay. So I spoke to my friend. She's a PhD student over there. Or actually more probably.
So he's there present.
Yeah, he's that. Lohit Reddy is the president. So when I was talking to her, what she had also said was, I mean, Abhishek, I don't mind picking it up. Okay, but her thing is on Monday. Her duty is on Monday. So see, it's a call that we have to take, cautious call also, because this is a very crucial time where any of us can be affected. If it can be picked up by a doctor at Gandhi from our place or your place for that in this case, and given there, because she knows Lohit Reddy, and there's this other guy who's coordinating a lot of things called Arjun. Is Arjun your friend?
Pranay, you've muted yourself.
Pranay, you're muted yourself.
So the other guy I got a contact was, just a second, Dr. Abhilash.
Dr. Abhilash. Okay. See, there might be multiple of them.
Yeah.
What I suggest, Pranay, is giving it to some doctor there who can take it to Gandhi. But
I asked him. I asked him. I spoke pretty frankly with him. So he said, boss, the reason I'm staying in the PG hostel is there is a shortage of people. So even for example, Sandeep's friend who's the speaker today, Sandeep was telling after 2-3 days, he's also going to move to COVID-19 duty.
Okay.
Yeah.
So he's like, we don't have anyone whom we can send like that to come to your place.
No, that's what I'm telling. My friend can pick it up. No, she said she can pick it up.
Tomorrow?
Not tomorrow, but Monday.
Okay, fine. What's her name?
Her name is Sindhura Yamajala. I'll send you her details. I told her I might give her contact to you because you have the pieces on you. Okay. And she stays in Hasmatpet.
Okay.
So Manovikas Nagar, exactly. So she drives by that road only because she goes in that area only every day to go to Gandhi. So she can pick it up Monday and she can give it in Gandhi.
Okay, fine.
That reduces the
I
need
think
of
that
any
will
of
be
us
safer.
going.
We will be putting ourselves at risk. No, I've not muted myself. Okay.
Was that Kiara?
No. So I think let's better.
We can do that. I'll tell him that we are sending on Monday, not tomorrow. I also he said, boss, I can understand your concern. If I was not a doctor, even I would have had the same questions which you have in your mind right now. That is the reason we are not calling you to the hospital, but to the hostel. If we had someone to pick it up, we would have sent, but unfortunately the situation at the moment is not like that. Then I asked him what's the other requirement. He said, look, total PG students are about 400. Then I asked him other doctors and everything. He said total strength will be about 550 to 650.
We have covered most of it so far. And
no, we are giving 250. We are not giving 500.
Oh, we are giving 250. Okay.
Yeah. The other 250 to RCHD is at their.
Okay. We'll plan out what else we could do next. But so what I was suggesting, Pranay,
then he also said that we are getting PPEs from the government, but we don't know by when and how many we will get. So if you can arrange for those as well.
Abhishek,
So what we'll do is
let
we'll
us
send the
figure out-
first batch. Yeah.
let us figure out the next consignment. How long he will take to deliver another 1,000 pieces of this?
No, but
And
dude,
the-
we need 1,000 pieces.
No, we need another 300 pieces to 400 pieces, Sandeep.
No, Sharath uncle has told, right? Whether as soon as he gets these pieces approved, he wants another 1,000 pieces
One
immediately.
second. There's an update.
I think let's not.
You are aware there is a separate PPE group which RCHD has formed today.
Okay.
Pranay, 1 second. Let me just one second. See, I think what we are talking about. I think I've already informed Sandeep about this PPE group. That PPE group, I think it's only us helping them source and distribute the PPEs for RCHD. I think what Sandeep is talking about over here also, I think would be regarding the PPEs that we are going to do as a separate club, or I mean as a satellite club. So when we are talking about when we are giving another 250 to 300 for this kya bolte isko, Gandhi, we might order 1,000, but 700 might be for RCHD, 300 might be for us. I think that we'll have to make that assumption.
The only thing I'm saying is let us place the order after confirmation. Let us wait for a couple of days.
Obviously. Yeah. Let's.
So
yeah.
In the meantime, we
obviously
can have the modality set, na? Like Abhishek, if you can ask them about a 500 micron thickness also. I was discussing with Pranay that 300 micron may be a little too less. They might need 500 microns.
So about that, I'll have an update. I'll share it offline after the meeting. I'll just call you two guys and share.
Yeah, even I have an update regarding that. I think we three can get on a call and just discuss about that later on.
Yeah. Okay.
So
at the moment, Rahul, nice haircut.
Did he just do this?
One and just removed everything.
It's the Tirupati effect.
You know, he's the luckiest guy after lockdown. Yeah, he doesn't have to rush to the barber to get a haircut, dude. Like all of us, the first thing we'll do after lockdown is go for a haircut.
I'm luckier. My barber came home this morning.
Lucky fellow.
So Sandeep, you should put on your camera so that everyone can see how stylish you are in lockdown.
Oh yeah,
actually, guys, before we continue, one last thing.
Over here, you know, Sandeep. See, look at him, designer beard. Show
guys,
turn your face.
Acha, guys, Pranay, Sandeep, just 1 minute before we continue, let us finalize on one thing. So in the end, like the doctor friend of mine will be picking it up from your place and giving it to Gandhi on Monday. That's the final outcome, correct?
Yeah.
Okay, chalo, done. Okay. So yes, now getting back to Sandeep's
waiting
beard,
for our speaker to come online. He'll be here in the next 5 minutes. Shivan, any birthdays coming up this week? Birthdays or anniversaries as such?
I'll just check. Give me a second.
Okay. Nice. I'm enjoying seeing so many members online. It's fun this way. Welcome everyone. Who is this iPhone?
There's just one birthday this month.
Okay.
Yashi and Manjari.
Oh, okay.
Anniversary is this month. 1 second. Okay. Devang Dugar's anniversary is on 19th.
Yeah,
19th April. Okay. I mean, Manjari's anniversary and Devang Dugar's anniversary is the same day.
They're the same thing. So.
I'll just check with the speaker. Just give me a minute, huh?
Yo, bro. Shivan?
Yeah, bro.
I think announcement bhi kar lena ki to get attendance you have to show your face on the screen.
Yeah, I think once the speaker comes, I'll just make an announcement that just turn on your videos.
Yeah.
It's absolutely all right to turn on your videos. Just go on mute, but turn on
I
your videos. So see that.
Okay, the speaker will be here in like a minute.
I think he's joined.
I'm here.
He
There's
joined.
already
Oh, nice. What's up, Karan?
What's up? What's up? Hello, everyone. I hope everyone's staying home and staying safe.
Staying home and staying bored. Yes, I understand that. Okay, everyone, I'd like to introduce you to Dr. Karan Udesh or Sri Karan Udesh. My God, that's a long name. Sri Karan Udesh Talangura. Okay.
I think you should get on with it,
Yeah. Actually, yeah, that'll be better.
Hey guys, good afternoon.
Guys, sorry to interrupt. One second. Everybody else, please go on mute. Just make sure, guys,
actually,
everyone
everybody
is
else
on
go on
mute.
mute.
Thank you.
Karan, you have the floor, bro. Go ahead.
Hi. Hello, everyone. I just want to give a talk on coronavirus and basically just give you an overview of what it is and kind of try and address all the rumors also of what's going on WhatsApp and social media and all these things. So I'll just start off with what is this coronavirus. I mean, there have been coronaviruses since time immemorial. Your common cold is because of the coronavirus. Almost 10 to 15% of your common cold is because of a coronavirus. This coronavirus, this is called the SARS-CoV-2, as you guys know by now. It is basically a beta coronavirus. Similar viruses that actually infected humans happened in 2003 and 2012. 2003 it was called the SARS, and 2012 it was called MERS, which was the Middle Eastern Respiratory Syndrome. This one, as you guys know, it started off in China and now it's spread almost, it's become a pandemic now. I'll just talk about the route of spread because that has actually become the mainstay of point, how there's so much panic, how does it spread? So I'll just address that first. Basically, what it predominantly spreads through respiratory droplets. That means when somebody is coughing, sneezing, talking, and it occurs when you're just about like 6 feet and you're in contact with them for about 15 minutes. Then there is almost a definitive chance of that spreading to you. So you have to be within 6 feet of distance within a close confined space for about 15 minutes. Only then the probability of it spreading is predominantly high. It's not like, somebody coughs and you walk there for like, after an hour you'll get coronavirus. It's not like that. It's not an airborne illness because a lot of people have been propagating the myth that it is an airborne illness. It's not an airborne illness. The droplets do stay in the air for a while. That is, say, for about a minute or two, and then they settle down. So that's what actually happens. So you have to actually have been in the vicinity of people to contract the disease or the virus. So that is one thing that I want to address. Now, the next thing is the rate of spread, how fast and how contagious it is. Predominantly, what happens is, say, suppose I have coronavirus. I can spread it to another 2 to 3 people. That's why it's really dangerous. Wherein previously, like if you took other like SARS and MERS, they only spread about one. It could spread to only one person. Here you're almost spreading 2 to 3, and this guy goes on infects another 2 to 3. So it's highly contagious. That is the main thing about this. And the other thing is, it's not like you've met me, you'll get coronavirus. It has to be within, like I mentioned, in that specific time frame of 15 minutes and stuff. Now let's just take another example. Like say you've gone to the mall and there is this one coronavirus patient who's just roaming around. He'll probably end up infecting only 5% of the people he's met. That is like, if he meets 100, probably 5 people. But the same guy, if he goes back to his house and if he starts spending time with his family members, say there are about 10 members in his family, he'll infect at least 3 to 4. Definitely. 4 people are going to be infected for sure. So this is what is called as the secondary attack rate, which is like 40%. That means definitely 40% of people who are in close contact will get coronavirus. That is something that you guys should know. So basically, when you compare it to the previous outbreaks, this is very, very contagious. Now we'll just compare to the how long does it take. Say suppose you've come in contact. Predominantly within 5 days you'll see symptoms. Like that is if you're symptomatic. Most of the patients are asymptomatic also. So I'll just give you an overview as to how many like patients are symptomatic, are asymptomatic, how many are getting severely ill. Predominantly 30% are asymptomatic, around 50% are symptomatic, 15% need hospitalization, 5% end up needing ICU care. So the broad spectrum, only 5% are getting severely ill. That is what something that you guys need to know. So it's not like if you get coronavirus, you should just panic like, oh my God, this, I might die. Like, don't have such fears. And whoever the 5% that are critically falling ill also are predominantly age groups greater than 65 years. And they have multiple issues like coronary artery disease or diabetes or hypertension. So these are the main things. If you are infected and you're above 65, you have multiple health issues, that is the greatest risk. These people have greater risk of mortality. Not, your younger age group. Now that I can see most of you are young, you don't have to worry. But at the same time, the fact that you can spread the disease, you have to maintain social distancing. That is really important. That's why the lockdown and all these things. And like I said, within 5 days, you'll see your symptoms. The symptoms will predominantly be fever, a dry cough, and in severe cases, you'll feel shortness of breath. That is another thing that you need to be aware of. In severe cases only, but predominantly it's fever and dry cough. And the reason it's spreading so fast is, even before you get the symptoms, even if you are asymptomatic, you can potentially spread the disease. That is the problem here. You will go on to spread even though you don't have the symptoms or you are in the pre-symptomatic period. With other viruses, it wasn't like that. That is the reason. So that is the big problem. This is a highly contagious disease with a very low mortality. That is the thing. Now I'll just address the mortality numbers. Now India, the mortality is about 2.8%, which is really low. That means if 100 people are getting the disease, 2.8 are dying. And out of that also is majority elderly people. So that's another thing that understand. And diagnosis part, like when do you have to get tested? Suppose say you feel you have having dry cough, fever and all. We have 8 laboratories that are privately run here. Like there's Vijaya, I think, and there's Path Labs. There are a few, you can just Google them up. But the government wise, it is Gandhi, Usmania, Fever Hospital, NIMS. You can get yourself tested there, but a doctor has to write a prescription for you saying that so and so is suffering from these symptoms, so hence he needs this test. But do you actually need it? Depends on your contact history. Did you actually come in contact with a person who's had coronavirus disease? That is really important for to actually get yourself tested. Don't unnecessarily panic and get yourself tested. Only if you have a contact history, then get yourself tested. Now then again, we'll just talk about the treatment. There's no definitive treatment. It's all supportive care. Hydroxychloroquine has been making rounds. It's really not shown much, it's not like if you give the drug, patients are getting cured. We really don't have much data on that. We really need more data to say that this drug is going to cure the disease. Predominantly, it's just supportive. Like suppose if patient needs ventilator, you just put him on a ventilator, oxygen mask, whatever, IV fluids. It's all very supportive kind of treatment. The next thing is the preventive measures, wherein there are so many questions that are like on a daily basis. I get like hundreds of questions on this. I'll just address the main things. Best method is hand washing, and don't touch your face unnecessarily. Best method is hand washing. And the second best method is you use a sanitizer which has 60% alcohol content in it. So that is important. And the other things you can do is you try and use your non-dominant hand for like opening doors or something, because the chance of you touching your face with your non-dominant hand is really less. So you can try and use that as well. And the next thing is this big masks topic. Masks, if you're staying at home, you've not come into contact with anyone, you just don't need a mask at all. Say if you're going out and you have to buy groceries or whatever daily chores that you have, wear a cloth mask. For you, it should suffice. But please remember that putting on a mask does not protect you from grabbing the infection or getting yourself infected. You have to practice hand hygiene and whatever measures I've just mentioned earlier. There is only a 20% reduction if you wear a mask. That's it. It's not, even when I'm working in the hospital, if I wear a mask, it's not guaranteed. I have to take other measures, otherwise I'll get infected for sure. So predominantly for you guys, you have to make sure that you wash your hands. That is the absolute integral. There's nothing that beats that. And just stay at home. If you stay at home, you'll not get it. I'll give you guarantee on that. You will not get the disease if you stay at home. And the other thing is, say suppose you are actually caring for a patient, like say your wife or your grandmother, whoever is infected. Make sure that then you put on the mask. Then it'll help. Otherwise, you don't need a mask at home. And say if you have a coronavirus patient at home, how do you deal with it? Make sure that that person is using a single bedroom, a single bathroom. All his bed sheets, utensils are kept separately, are being disinfected regularly. And this is to prevent what is called the fomite transmission. I'll just give you data. A lot of people again ask me this question: how long does the virus survive for on surfaces? See, it's different from survival is different from viability of the virus. Now, say I have infection, I sneeze on, like say, the laptop. It says that data says that 24 hours the virus is going to be on it. But how viable? No, it's not that viable. The load is going to come down, so you're not going to contract it. But the data says, this is again, it was done in a very controlled environment, 22 degrees. It was in a close confined space. So we can't really extrapolate it to the real world settings. So you don't have to worry about the fact that what if I touch the doorknob, somebody sneezed some 48 hours back. Will I get it? No, if you touch it and you put it in your mouth, only then you'll get it. Like if you put your hand, whatever, you're not going to just get it by touching it. So that you have to be really clear about. The next thing is, again, I get a question is, can I be reinfected? I think it's highly unlikely. I'll just give you the reason why. This virus is so beautifully programmed that it has what is called the spike protein, and it just attaches to yourself really well. And our body is actually producing antibodies really well. So once you get antibodies, the rate of reinfection is very, very unlikely. Now, I'll just give you an example. What happened in 2003? One patient got infected. He was immune for about the next 3 to 4 years. That's why SARS had died down. The reason coronavirus is spreading is because it's highly contagious, because of its high reproductive rate and high secondary attack rate. Not because of the fact that, it is a deadly virus. That's the thing here. And one more thing that you guys have to understand is, whenever a virus gets a lot of hosts, it will keep on, it won't mutate into an aggressive form. It's easy for it to get, infect humans. So it's never going to get deadly. So it's going to be a mild virus only. And don't get into this thing of, oh, India has a, lesser strain, Italy has this strain, this is going to mutate, it's going to become that. No, that's not going to happen. Even if it does, I don't think it'll happen in the near future. Now, the other question I get asked is regarding this vaccine. Please don't fall for things like homeopathy medicine is working, or, some ginger or garlic and all that nonsense. It doesn't work. There's no vaccine, there's no prevention at this point. And also hydroxychloroquine is not for you guys at all. It is for doctors like me, which I myself am not taking. I don't know why ICMR has recommended. There is no data on hydroxychloroquine preventing coronavirus. So please don't go buy hydroxychloroquine. It's a very toxic drug. If you take it, you might end up having more problems than actually, getting benefit from it. That is one other point. Now, the other thing I wanted to think, the summer season question. Now summer is coming, Corona jayega, all that thing. The thing here is, even we are such a indoor society these days, everywhere there's ACs and everything. So it's all about contact. It's not in the air that it's going to happen. So I really don't think it's going to matter. The spread is going to be there if you don't practice social distancing. Please still practice social. Now you take an example for Australia and Brazil. They have peak summers, but the cases are rising exponentially. It's really not making much of a difference. So all this is, hearsay. We really don't know what's happening here. But my personal opinion is summer is really not going to make that much of a difference. Yeah, the only difference that it is, the respiratory droplets, because the humidity will come down and settle on the surface faster. Nothing more than that. That's going to happen. And the other thing is mental health issues during lockdown, especially people who are married and are, with their wives and all. What happened recently is after China kind of lockdown was lifted, the divorce rates went up really high, So all I want to say is separate yourselves for some time, give yourself what is called that me time, and make sure that you please shut off social media for some time, read something that you're interested in, and get into your routine when it was before you're going to work also. Sleep regularly, eat healthy, get some exercise, take lots of vitamin C. Lots of, in the sense, don't pop 10 pills of vitamin C. Just take 1 tablet per day, that should suffice. Again, some people are like, they're hoarding vitamin C and taking it all. Again, vitamin C can cause toxicity. Please remember that. Anything in moderation, that's what is important. So with this, I think I've addressed the majority of issues that I've been asked by my relatives, my parents, and patients. I would love to hear from you guys what questions that you have.
Please raise
I have a
guys,
question.
any question?
Sure, go ahead.
Yep.
You can call out your names.
Sure. So hi Karan, this is Abhishek. I have a question. Actually I have 3 questions. I'll go after it one by one. First question, when you spoke about surfaces, there have been a lot of studies. I'm not talking about WhatsApp, but I'm just talking about something that some articles that have come up and of how the virus survives on various surfaces. When you talk about steel, when you talk about plastic, predominantly viruses are supposed to die within an hour on any surface. But this is, and I heard you said 24 hours, the virus is there, but I mean, we don't know the stability of the virus, 1, and number 2 is you don't know whether it'll be affecting you as long as you don't put it in your mouth or your nose.
Correct.
Obviously.
See,
you were saying something.
Yeah, the study that you're referring to was published in the New England Journal of Medicine, wherein what they did there was they did this study in a controlled environment. It was 22 degrees centigrade, and they tested it on in air. It survived for about 4 hours. On wood or cardboard, it survived for about 24 hours. On plastic, it survived for about 48 hours. And on stainless steel, it survived for about 72 hours. That is the survival of the virus. Viruses per se, you will talk about their survival when it comes to transmission in terms of what is called viability. That means how effective it is going to be in infecting you. Mere presence of it does not mean it's a viable virus. That is the thing that is clear. So that is a control study that was done in New England Journal of Medicine, wherein they said this is how long it's going to survive for. But is it viable? There's no data on that. The study that you're talking about. Please go ahead. Sorry, I think I interrupted.
No, I think you pretty much answered my question. But the other thing I wanted to just as a footnote or something, I just wanted to put forward. So do you recommend for everybody, whoever is above 65, who's at a higher risk of coming in contact and probably being lethal or something for them, do you recommend any surface that they use on a day-to-day basis be because all of us have grandparents at home or some of our parents might be above 65 as well.
Correct.
Do you recommend that all these surfaces be disinfected every day? Because there might be some people who might still come from outside and go back. So is that something that you say you should practice or you shouldn't practice, or even doorknobs, or let it be?
It honestly, it breeds more anxiety than actually, helping. I'd recommend you do it, say some pizza guy has delivered a box to you, or your maid has come and we don't know where she's been. So in that case, yes, you can always, practice disinfectant measures. But otherwise, on a daily basis, if it's just you people, really not required.
Okay. All right. I think that pretty much answers. My second question was, when you were talking about temperatures, I read another study about how the virus's stability changes with temperature. I don't remember the exact numbers, out there?
Again, see that particular study, again, I think it was in Lancet or something that it came up. I don't remember exactly the journal. The previous one is NEJM. That study is completely different, wherein it sees how the virus is going to mutate, and it really doesn't depend on the temperature also. The virus is only going to mutate two things. It's just simple evolutionary. A, it is finding it difficult to get a host. B,
Okay.
it is finding it difficult to survive in the body itself, like in the host itself. Only these two instances, it's going to mutate. And it's an RNA virus, this coronavirus. It's going to keep mutating anyway. The viruses mutate on a really, fast basis. But
Correct.
whether the temperature is going to actually make it deadly, less virulent, more virulent, no data on it as yet. And we don't know what's going to happen at this particular moment.
And my last question, I think, is, I mean, you gave a very, very good insight on what sort of vaccines would be done, we should follow, or like not going for homeopathy or any other self-proclaimed home remedies for coronavirus. That was very good. But is there any research, I mean, as per your knowledge, because this is something I was curious to learn about, which I couldn't come across. Is there any research or anybody who's working on, say, plasma-generated vaccine from the already recovered cases? I think we have about 200 plus or 300 plus recovered cases in India. So I think that would be one way of developing the vaccine, or probably for the Indian.
It's a good question. Generally, that's how they're going to do it. And now what is happening is, when you talk about plasma, actually they've used it for two reasons. First thing is treating the severely critically ill. An article came out in JAMA wherein they actually, in China, what they did is they got the plasma from patients who recovered and they injected it into the patients who were critically ill. All 5 of them recovered, but that's a very small data set of only 5 patients. They're using it to treat patients. It's been there, an age-old technique for like 100 years, since the Spanish flu times that's been going on.
Okay.
The second question is, when you've asked about, is the vaccine in development? Yes, there are, I think, 5 laboratories that have been set up, especially they've been funded by Bill and Melinda Gates Foundation on 5 different kinds of, proteins. Like there are E protein, S protein, M protein, SMP protein that this virus produces against all kind of, trying to get a vaccine. But it's going to take some time. First, they have to do it on mice. Then they have to do it on non-ape primates, then primates, then in a small set of humans, then large set of humans. So ideally, it's going to take 12 to 18 months for the vaccine to actually come into play.
The general time for any clinical trials. Yeah.
Yes,
so
it's going to take up.
I think that I think answers all my questions.
Any other questions, guys? Yeah, go ahead, Pranay.
Karan, thank you so much for sharing such wonderful information with us. What I wanted to know is, once the lockdown is lifted, say maybe after 15 days, 20 days, whatever it may be, what are the precautions that we need to maintain at our workplaces? So we run a manufacturing unit. We've been seeing videos about, apart from hand washing, that is, we've been seeing videos about people disinfecting their premises using some sort of spray or something like that. So what are the precautions that we can take to ensure that, we don't attract this very easily?
First thing is, what you need to really tell your employees is about contact tracing, or whether they've actually come into contact somebody who's sick. Whoever has been coughing or has fever at home, such employees, just be upfront about their symptoms or symptoms around, their household. First thing that you need to do, because even if you install, say, thermal scanners, like I said, before the patient, develops symptoms, he might actually spread the disease. So that is important, the first thing. The second thing that needs to be done is the disinfection. You have to disinfect yourself and the surfaces that you constantly use, rather than disinfecting your entire unit, which is really not viable. I don't think it's that easy to do it on a daily basis. You try and disinfect your table or your mouse or your keyboards, the ones that you kind of daily use. or your manufacturing process, whatever that is. So I think that is more recommended than the entire premises. I really don't think it's possible to actually do that. And ask people who are sick to just not show up for work for 14 days at least, since their symptoms have subsided. That is one thing you can do. And there is no real magic agent to say, okay, I put this agent on surfaces, now there's no coronavirus. We really don't have something like that at this point. But having said that, I think sanitizing, using a 60% alcohol on keyboard and also should suffice. It's really not going to
More
make much
about
of it.
peace of mind than anything else.
Correct.
Basically, people feel secure that they're in an environment where they're being taken care of.
You can do that. It's, yeah, you can address the anxiety of the your employees, but I don't know how well you can do that. If you can do that, that's really great. But I don't think a company can afford to do something like that on a daily basis. I mean, that's what I personally feel. But if it does,
sorry to interrupt you, Karan, don't you think it will be easier, like, to actually scan these guys and stop anybody who's at a higher temperature and tell them to take a break for like 14 days? So
No, see,
corona will not enter your factory if you don't have a person who is likely to have had contact or has any symptoms of the virus. Or like you said, do you think that will be more beneficial?
No, like that's what I was saying. With the thermal scanners thing, we really can't be sure. Like, see, like your workers, they'll come from, say, they'll come on a bike or a cycle or whatever. They might come walking also in the sun. The temperature that you or the thermal scanner shows, it's not going to be the actual temperature of the body. So it might actually have a false, positive, being like his temperature might be 99.5 or 100. So you don't know. Or like I said, he might be asymptomatic and his temperature might be normal. So it's difficult that way. The other measure I would like to actually, if possible, do it on a rotation basis, wherein one worker turns up for 3-4 days, the other comes up after one, like rotational shifts. That's what we practice in our hospital as well. It'll help at least for some time until the curve actually completely goes down.
Also, I just had one more thing to add. So I've seen recently that Kerala and I think even South Korea had started putting up disinfection chambers in most of the public areas. I think even Kerala and even in Hyderabad, I'm seeing a couple of my friends who have started looking to manufacture these things. So do you think will they be helpful, like even after the lockdown, like to have it at the entrance of your workplace, to have like disinfecting chambers and have your employees walk through that and then be disinfected and then probably like they can come into work? Do you think that'll be helpful?
I think so. But what exactly are they using in those disinfectant chambers is something that we should know. It depends on what they're actually using to disinfect, what chemical they're using, what are the measures that you're using. I'm not aware of what the exact measures are, but if it is something like, that is actually like, say, 60% alcohol content that it has in it, it should be enough, whatever that is. That should actually suffice. You really don't need to spray bleaching powder on people. Be like, ab andar aa sakte ho, you know what I mean? So that extreme measure is really not required. That's what. And one thing is, it's
fairness
not
cream
deadly.
laga some bleaching powder ho jata uska.
Yeah, it's the thing that the bottom line as a doctor that I've seen is, it's not deadly. It's really not deadly at all. It has a mortality rate of about 1%. If we just took this much care for tobacco and alcohol, curtailing both of them, my God, humanity would have gone to the next level. Like, just for this one coronavirus, the way they're like spreading so much panic. Yes, you have to be, aware, but there's no need of such kind of panic. That's what I personally feel.
I had a question.
Sure.
So if supposing you have fever, and it's not necessarily a symptom of that, like someone who's already gone to Gandhi, got it checked, but there's no one else to look after him. There's no doctor that you can actually go to, because most of the doctors who do these private clinics are anyway saying that they're not practicing at this point.
Correct.
And most of the hospitals are not accepting patients otherwise. So where do you go? Like, what do you do? What's the solution for a regular fever or regular symptoms that are not related to corona?
You can always call me. I'll put my number in the meeting room. But no, on a serious note, Yeah, it is actually, I mean, I've had a couple of patients call me being like, sir, I have fever and people are not accepting. Unfortunately, at this point, because the hospital infrastructure is not well equipped to handle certain, I mean, the outbreak at this point, only few hospitals are taking it. If it is a mild fever, there are a lot of doctors who are doing it online. I myself am doing it. I give an online consultation. You can always, reach out to people like us. And there are other helpline numbers also. I think the Ministry of Health Affairs has actually put up on their website. You can go through that. But if you must get admitted, unfortunately, at this point, only those hospitals are available. And it also depends on how much caseload they have. Some people are being, sent home being like, you don't require admission. Or it's actually a little bit of, there is a little bit of uncertainty and chaos that is there in that field. But if you're just having fever, you can always contact people like me.
Hi, Karan.
Hey, hello.
Hello.
Yeah, I can hear you.
Yeah, I just wanted to ask, what about people who are under the category of manufacturing of essential goods, go to their respective factories and come home to their grandparents, who one of them is diabetic and the other is undergoing dialysis? Like, what measures should we take in order to maintain safety at home with our grandparents around? Because we're going to factory right now, that's why.
What I would suggest is what I'm doing, because I mean, I have a grandmother who's like 75 years old. She also has a lung condition. So I just go to the back of my house. I kind of, take off all my clothes there, get into the back bathroom, just take a shower and then come inside the house. That's generally what I do, because I could be exposed because I'm working, in a hospital that probably has coronavirus cases. And so that's the thing that I do. But since you're also working, the one thing that you can do is you can just try and, wash your hands first thing and just change outside if possible. If there is a, provision like that, you can just change, put on a new set of clothes and just come inside. You can just throw your clothes in the washing machine or whatever that is outside. You can practice that.
Okay.
And
thank you.
Also, if you feel you have, you've contracted or something, just, stay away from your grandparents, 6 feet
correct.
distance, maintain social distancing, or confine them to a single room.
Okay.
Okay, well, I have a question. Now what's happening is a lot of people you come across, for example, you're having a maid calling up and saying, we've got mild fever. Somebody's calling and saying we have a throat. Now, I want to understand now, what is the right time? Like, if somebody's having a mild fever, somebody's having just a throat, somebody's just having a motion, does all this also it could be symptoms of that or start of a virus, or they're just normal weather change effects?
So
how do we know this is the time to go and check? What is the right time to do that?
The right time to get yourself checked is if you're having symptoms that are predominantly fever, dry cough, predominantly. Now say if you have a runny nose, predominantly that is a flu-like symptom. From whatever data that has come out from all China, Italy, everywhere, 95% patients have not had runny nose. That is a flu-like illness. It's not a COVID-like illness. But if you're having, there have been case reports where patients have presented with diarrhea and fever. Those have become COVID positive later on. Initially, they thought it wasn't. So, but that is only 10% subset, but predominantly it is fever and dry cough. And most patients, again, like I said, will be very mildly symptomatic. So you can get, if you feel, you can always get yourself tested. But then again, what you need to understand is, please remember that get yourself tested if you feel there is a contact history, like you've gone out, otherwise no need. If you've gone out, if you've come in contact with other people, yes, get yourself tested. Otherwise, really not required.
All right, thank you.
I have a question.
Sure.
Shivan, please go ahead.
Yeah, so my grandmother goes for dialysis every second day. It's generally my father and my mother accompany